right, everybody. Welcome here to this episode of Freedom Hub Working Group. I'm your host, Jeff Cantor, along with my co-host, Charles Froman. We are being sponsored by your Freedom Hub, which is where all the disruptors congregate. We've got an interesting speaker for today, you'll find out. And before we do, just so you're aware, these are all recorded. This is a registration to come to register for future ones. And then if you want to see this, which it's released on Sundays, so therefore every Monday morning, all the new webinars are up. And as a little bit of a diversion here, you'll see this is some of the locale. Here we are on BitChute, Brighteon, and also up on YouTube. So you'll see a variety of them to pick from. So, but though today, as I said, we have a great speaker. So I'm going to have Charles be the presenter here on who is our speaker for the day.
Will do, Jeff, and thanks and welcome, Dan. Dan is someone I knew going back to the 90s when I was a Republican congressional staffer, and Dan was one of those think tank economists over at the Heritage Foundation. And then he joined Cato, where I worked for a bit in the early 2000s. And I just learned during all of this time that he has also been a scholar at the Center for Freedom and Prosperity, which I thought was new, which I even thought he might have founded, but he might not have. So he can correct me on that. But Dan is well known by a lot of folks who focus on DC. He's called on a lot to give his econ pronouncements on the controversies, and we certainly have a controversy today. So many folks are itching to get out of lockdown. There's more and more folks concerned about the bad effects of the lockdown, the waste of the bailouts, and not to mention the trouble the economy was in before the hysteria. So we definitely want to have a deep dive in the economics of the controversy. So that is what we're here for today, Jeff.
Very, very good. All right, Dan, I'm going to put you in charge here. And I'm just going to kind of leave the one site sit up here until you instruct me to send us to somewhere else to view. And the floor is yours.
Well, thank you very much. Maybe the thing to do is if you could put up my my blog, the danieljmitchell.wordpress.com site. No, not Dan J. Mitchell, Daniel J. Mitchell, because the most recent column that I wrote today is very, very relevant for what we want to talk about, which is the interaction of the economy and the coronavirus. And if you scroll down a little bit, what I do is I cite a couple of articles, one by Andrew Sullivan, one by Tim Worstall, but then I also provide links to several other articles where every single person that I'm citing, including some folks that are more on the left than on the right, basically, if you're at all cognizant of some of the economic literature, you know that there is a genuine trade-off between lifespans, health of a society, and the underlying prosperity of the economy. The simple example that I oftentimes use when discussing this is that there are 30,000 fatalities on the roads every year. Well, why don't we have a 5-mile-an-hour speed limit? Well, we don't have that because everyone knows that would be crazy. It would be economically crippling. Not to mention it would just drive people nuts if they had to drive to work at 5 miles an hour. Although, before coronavirus, you sometimes did drive 5 miles an hour on the DC roads. But we don't do that. We don't impose a 5-mile-an-hour speed limit, even though it would save lives, because we know that there's a trade-off. We know that every time we go out of our house, every time we fly on a plane, every time if you go scuba diving, there's so many things that we do in life that carry some small risk with them. And we make adult, mature, intelligent decisions on what are the costs and what are the benefits of different actions. That analysis, and by the way, one of the big scholars on this, I should say, is Cass Sunstein, who was the director of the Office of Information and Regulatory Affairs, OIRA, at OMB under Obama. And he's written extensively on what is the economic value of a life. Now, it sounds heartless and cold, and somehow you're a bad person if you try to phrase things in that way, but it's very well established in the regulatory world, in the economics world, in the legal system. How do you think when they do lawsuits, how do they decide what the liability is if a product winds up hurting someone or costing them their life? There are all sorts of ways in which this type of cost-benefit analysis exists all throughout the economy. However, in the current debate over coronavirus, when people say, well, maybe we shouldn't keep our economy locked down this long, or maybe we shouldn't lock it down in quite this way because we have to look at the costs and the benefits, somehow you're a bad person because you're putting a price on human life. Well, there's always a price on human life that gets done all the time, as I said, in various fields, legal field, economics field, regulatory field, you name it. And in the case of the coronavirus, I have to confess right offhand, like almost everyone else who's pontificating on this issue, I am certainly not an expert on epidemiology or anything like that. So what I try to bring to the table is to simply get politicians, get congressional staff, get journalists to understand that it's not unreasonable to consider these cost-benefit trade-offs. Imagine if we kept our economy locked down for 6 months. Because unless there's a vaccine, we are looking ahead at some very grim, difficult times, because even when we begin to reopen the economy, there could be a second outbreak like there was with the Spanish flu back in at the end of World War I, after World War I. And so you could have people going back into the economy, have another outbreak. Really, the only thing that's going to pull us out of this thing with as little cost as possible is the quick development of a vaccine. But until that happens, we're going to have to basically make intelligent decisions ourselves on how quickly do we reopen the economy. And I'm not talking about what the government is doing. I'm talking about individuals. If you're running a business, if you're a worker, what sort of risks are you willing to take? Because sooner or later, yes, right now, a lot of people are sitting home just waiting for some sort of check or a handout from the government. And some people rationalize it, well, it's the government's almost done the equivalent of a regulatory takings. It's prohibiting us from working, so it's legitimate for government to compensate us by giving us money. Well, of course, they're giving us our own money, so I have problems with that as an economist. But the reality is, politicians have already gone through a lot of money. They'll probably go through a lot more money, but none of that changes the fact that there is this genuine cost-benefit trade-off, these decisions that have to be made, ideally by individuals, not by governors, and certainly not by the president. It was very just disappointing, I guess I'll say, to see Trump say, no, he's in charge of reopening the economy. No, he is the chief administrator of the executive branch of the government. He's not the economic dictator of the United States. To the extent that there is any authority to try to shut down an economy, it should be happening on the state level or ideally at the local level. But ultimately, of course, as a libertarian, I want individuals with as much information as possible making mature, adult, sensible cost-benefit decisions about when do we get economically active again, whether as workers or as employers or as business owners. What precautions are we going to take? I suspect we're going to see continuation of social distancing. It's funny, actually not funny, but it's just an observation. When I would travel to Asia over the last couple of years, it would be very common where I would see people just walking around with face masks. I wouldn't be surprised if we now have a bit of that culture, that pattern of behavior happening in the United States, because again, until there's a vaccine, I think you're going to see a lot of caution on the part of the American people. And I guess I'll sort of wrap up these introductory remarks by sort of bringing it back to what we think might happen in Washington. And I'll say that the most disappointing thing about, they're falling all over themselves to spend money here, give away money there. The most important thing we need in order to get information out there so people can make intelligent adult decisions is we need information on the prevalence of the disease. How many people out there have it? How many people had it and didn't even know about it and are now, in effect, have the antibodies in their system? So in effect, they could be almost like blue checkmark workers where they can go back into the economy because they're in no danger anymore. And this is where I have to say, it's not surprising, but it's incredibly disappointing that the bureaucracies, the Food and Drug Administration, the Centers for Disease Control, and of course, on the global level, just the rank incompetence and corruption of the World Health Organization, but specifically in the context of the United States, for the FDA and the CDC to, in effect, have been stymieing with red tape and regulation and senseless bureaucracy. They have basically made it very difficult for the private sector to respond with the development and deployment of widespread testing. If nothing else happens from this whole unfortunate, tragic episode in our country, for that matter, for the whole world, is we need to get rid of this sort of you have to ask permission type mentality that has governed the FDA and the CDC, and we need to have what people call permissionless innovation. If you want to, sure, have the FDA put up, these are the standards that we want people to meet for masks. I'd rather have the private sector through Underwriters Laboratory or something like that do it. Have the CDC say, that these are the specs that we want people to have for testing. But then let private labs, university labs, whoever else out there do things, rely on the legal system to punish companies that do things wrong through the tort system, but allow the private economy to respond effectively, because right now we are suffering because bureaucracy has prevented an efficient and an effective and a quick reaction. Okay, well, that's basically my my opening monologue, where I start ranting and raving about how upsetting it is that bureaucracy has hindered an effective response to this issue.
So first, anyone that wants to join me in asking questions, by your control panel is a little raise hand icon. And if you want to click that, I can see that you want to ask a question. I can call on you. And I do see a couple of folks with their hands up. Before I do that, you're not an epidemiologist, Dan, but you did kind of say that maybe folks are justified to lock down until there is a vaccine. Have you ever gotten into the politics of vaccines? And if you think decisions should be made by individuals, does that go for vaccines as well? Because of the well-known problems with regulatory capture of CDC by the pharmaceutical companies, should the government be able to keep families in lockdown until they take a vaccine? Number one, and then I'll kind of call on others to ask questions. There's the first question for you.
Wow, I confess I've never thought about that topic, because if a vaccine comes out, the presumption is just about everybody will fall all over themselves to get the vaccine. But of course, there is a community out there of people that are distrustful of vaccines. My gut instinct is that if somebody wants to take a risk, that should be their freedom. But that's just a sort of a off-the-cuff assumption. I know when you're talking about vaccines for like measles, mumps, rubella, that kind of thing, I know there's an issue that supposedly you endanger other people if you don't get vaccinated. Is that true in the case of coronavirus? If it's not true, then as far as I'm concerned, there's no issue whatsoever. But if there is some issue, whereas if you're not vaccinated against the coronavirus, again, assuming a vaccine is developed, if you're of no danger then to other people, then sure, go ahead. Just like it's risky to go hang gliding, I'm a big believer that people should be able to take those risks themselves. It's only when there's an issue of whether you're endangering other people that potentially state compulsion comes in. And of course, as a libertarian, I don't like that concept.
Okay, Kishore, if you want to unmute yourself, go ahead and ask your question.
Yeah, I think I'm not muted. So anyway, there are about FDA, a couple of questions. Off-label use of drugs has always been there. It's pretty extensive. So I don't understand this confusion over finding adequate proof to use anti-malarial drugs. I mean, where does it even come from? there's no mandate for off-label use to the extent I know. That's one. And then is this issue of the two mandates that FDA has with safety and efficacy. There are lots of questions about whether it should have this efficacy mandate at all. Safety is understandable, but if a drug is safe, like anti-malaria drugs, doctors should be able to prescribe it. But you still had so much controversy over it. I don't know where this confusion is coming from.
Well, again, I'll start with the caveat that I'm not an expert on specific issues involving healthcare, but as a libertarian, as an economist who looks at cost-benefit issues, I know one thing stands out for sure on this issue, which is that we should have some sort of mutual recognition with other advanced countries. So if you as a consumer want to buy a drug that's already approved in, say, Japan or the United Kingdom or Germany or Singapore, some other wealthy, well-run, well-governed country, that should be your freedom to do that. It should be the freedom of doctors to prescribe such drugs. For that matter, we should just have an automatic approval system where if another advanced country approves a drug, why should we require pharmaceutical companies to spend who knows how many tens or hundreds of millions of dollars to go through all the expense and costs of major trials in the United States? Now, in terms of safety and efficacy, again, I've never written and analyzed those issues from a scientific perspective. I would have no basis to try to do that kind of thing. But I do know when you're thinking just about common sense cost-benefit analysis, there are some drugs that are very important, but also very dangerous. But nonetheless, somehow they've gotten through the approval process because for some patients, even though a drug might, what's the old line? Everything's poisonous depending on the dose, including apparently water. So we do allow things into our system, into the medical system, that are unsafe, but they have some variable, some feature that makes them very valuable in some medical circumstances. Now, in terms of the efficacy issue, obviously you don't want a bunch of fraudsters out there lying to people, but in theory, under a common law system, there's already plenty of ways through the legal system to go after those people. And as you indicated, with the whole question about off-label use, we already have all sorts of drugs. An incredibly large percentage of drugs that are prescribed in the United States are for reasons not approved by the FDA. But once a drug gets approved for reason X, it's out there, it's available, and doctors have the right and the freedom to prescribe it for any other reasons that they've learned about just through trial and error over the history of the use of the drug. And so obviously as a libertarian, I want us to be as open as possible. I already mentioned the phrase permissionless innovation. We want to have as few barriers to innovation as we possibly can in the system. Now, I'm not hearing anything if someone's supposed to be responding to me.
Apologize, Dan. Charlie here. Thank you, Kishore, for that question on the drug issue with FDA approval. Dr. Fulvey, I see you've chatted a couple questions. Do you want to ask your question of Dan?
Yes, let's see.
We can hear you. Go ahead. Speak up.
Yeah. So my question was that given that the fact that people can be contagious, how would a free society handle the contagious people will invade other people's bodies and harm them? So how would a free society handle the fact that many people are contagious?
Before Dan, you answer that, Dr. Fulvey, how would you handle it? And maybe let Dan respond since you've probably thought about it.
Well, I believe that if everyone is tested, then those who are not infected, who test negative, that they're not infected with the disease should be given a badge and with the date of the test. And that way you would know, the employer or customers and others would know that this person is safe and he can then carry on as he wishes. If you're tested and the test is positive, you have the infection, in that case you should be confined and not endanger other people.
As advocating.
Dan, just 1 second, Dan. Dr. Ackland, I think there's some voices in your background. If you can mute yourself. Go ahead, Dan, answer that question.
I already unmuted everybody.
That's a tough question. What's the old line in the legal world? Tough cases make for bad law. I believe, if I recall my history correctly, the name that we probably all vaguely have heard of, Typhoid Mary, was a case of someone who was a permanent carrier of typhoid, and she was actually imprisoned because she refused to basically stay housebound, and she, every time she went out, she would infect people. Obviously, if someone has the coronavirus and they know about it, if they're going out and infecting people, just on a personal level, that's obviously grossly irresponsible and makes them just a bad person. It's sort of, if you have any communicable disease and you're going out and exposing other people, that just makes you a bad person. I'm not a lawyer or a legal philosopher or anything like that, so I don't know that I have anything really intelligent to say about what should be the guidelines for that. The problem we face now is that there are probably tens of thousands of people who have it, who are contagious, but they just simply don't know about it. And that brings me back to what I led my column with today on my blog, is that we desperately need more testing. That's a non-ideological, non-philosophical, non-partisan point that I think every adult with a temperature, with a IQ above room temperature, agrees with. Now, once we do widespread testing, and then if we find out that there are some people who are contagious that are going out and putting people in danger, I don't know, is that an issue where under our common law system, they would be subject to legal sanction of some sort? I'm just not competent to answer that question. I deal with boring economic issues.
And to that end, Dan, I see Dave Demarest has his hand raised. If you want to ask a question, David. David, you have yourself muted. Dave Demarest, I think you have yourself muted. Go ahead.
Dan, can you hear me?
Yes, I can.
Okay, Dan, why not industry standards instead of the FDA death by regulation? And obviously starting with home test kits. What are your thoughts on that?
Right now, we have incredible opportunities for labs and scientists and university research centers to make a boatload of money if they come out with, well, obviously the big money maker could be a vaccine, but then even easy widespread testing would be something that there's obviously a big profit motive, a big opportunity there for people to do that. But under our current system, you have all these FDA and CDC rules that make it incredibly difficult to get the approval, to go through the paperwork, to have the inspections and things like that. Ultimately, I would much rather have something like the medical equivalent of Underwriters Laboratories in charge of that, if necessary, and if people really think somehow you have to have FDA and CDC standards, those should just be publicly available on their websites. And in an emergency, especially, you have the right to just immediately start doing things that meet those specifications. Here's the frustrating thing. Normally, when we look at government regulation, we view it as something that increases the cost of doing business, slows down business. Okay, it's not the end of the world. We don't like it. It has an economic cost. Well, now we're dealing with something where the cost of the government inefficiency and red tape and regulation is not just monetary, it's people's lives are being lost. We're dealing with huge economic consequences, foregone GDP, because we don't have the testing out there. Even though, again, there is this obvious opportunity that people in the private sector want to jump at. That there must be incredible amount of research being done in sort of almost a Manhattan Project type way, but we're slowing down. Not we, the government, the regulators, the bureaucracy is slowing down the development and deployment of these things. And it's not just a monetary cost to us, as I said before. People are probably dying because of the government's inefficient structure.
Dan, do you think there'll be some permanent changes as a consequence of this, if they've been waiving certain things or rushing things through now? Will this make some good permanent change?
That's obviously the hope. There are several groups in Washington, such as Competitive Enterprise Institute, the Mercatus Center, all sorts of groups. The folks at Reason are writing great articles about how this needs to be a lesson that we learn about how this incredibly bureaucratic, inefficient system we have. We have to somehow learn a lesson from this process. I doubt we can get rid of it, of course. But if we can somehow give the private sector this permissionless innovation type model that they can go with, I think that would then be at least something good that comes out of this very sad episode in our history. And obviously, other countries hopefully will learn the same lesson. And actually, this is a point that I probably should have mentioned earlier. We are seeing countries with different approaches around the world. The East Asian economies seem to be handling this the best. And one of the columns I wrote, I don't know, maybe a week or so ago on my blog, Dana Milbank of the Washington Post tried to make the argument that, oh, this is a failure of having small government. We need government more involved. And the examples he cited were these East Asian economies like South Korea, Taiwan, Hong Kong, and Singapore. And in my column, I pointed out that government spending in these economies averages less than 20% of GDP. And we have a burden of government spending in our economy of closer to 40% of GDP. And of course, places like Italy and Spain that are complete disaster areas with coronavirus, government is more like 50% of GDP. And that was back before GDP collapsed. So it's very bizarre. There was this, in soccer, it's called an own goal, when you knock a ball into your own net. Well, Dana Milbank did the equivalent of that. He, in effect, made an argument that we should have small, efficient, lean, competent government like you have in Singapore and Hong Kong, instead of the bloated, inefficient bureaucracy we have in the United States.
Hopefully you're right in that regard, because we will need to move quickly. The problem always in our countries, we're all panicky until it passes, and then we all go right back to our normalcy and just let that opportunity slip right by. David, I see you've got your hand back up there.
Dan, I'm concerned about having all of our eggs in one basket with the hope for results on a vaccine maybe in 18 months. We know that flu shots don't have a very good track record. Their effective rate is dubious, and they still have a very large number of deaths due to flu. So my concern is, why aren't we focusing today on treatments and preventive medicine, especially, that would help us individually take charge of our health, especially if we have preventable underlying conditions? What are your thoughts on that?
As I've said several times already in this presentation, I don't have the competence to judge what are the most effective prophylactic treatments, what are the most effective, if you actually get the virus, what are the things that you should do, what are the off-label medicines that you can use. I suppose we're going to find out more and more as time goes by, as different countries are experimenting with different treatment approaches. One of the big things in terms of cost-benefit analysis, one of the big reasons everyone was talking about flattening the curve, what was that all about? Well, it was mostly to make sure that the number of cases, the number of critical cases, didn't overwhelm the amount of intensive care beds that we had, the amount of ventilators that we had. So it might be that if a vaccine doesn't get developed, we wind up in a situation where we just sort of, slowly let air out of a balloon in a way that doesn't overwhelm the capacity of the healthcare system. But nonetheless, people start going back to work, because coming back to where we started this whole conversation on cost benefit analysis, if you keep an economy, a $20 trillion plus economy in effect in a hibernation for 6 months, you're talking, obviously this might be an exaggeration because some things are still happening, like grocery stores and whatnot, but you're talking literally trillions of dollars of damage. I mean, 6 months of a shutdown isn't going to be half of our economy being lost, but it's going to be some very, very large number. And as we talked about already in this presentation, that amount of foregone economic output, that amount of foregone prosperity is going to have its own very negative effects on people's health, their longevity, their mental health, even not just physical health. It's going to be devastating for lots of families. So yes, we need the economy open as quickly as possible, but it's probably not going to be like flicking a light switch. It's going to be sort of people gradually returning to the workforce, businesses gradually reopening, for the simple reason that we can't afford for that not to happen. And we just have to make sure, ideally through individual choices, not a bunch of politicians and bureaucrats, we have to figure out how that happens in a way that minimizes the healthcare cost of doing so.
One question I was going to ask you, Dan, is if they turn the economy back on and all this time has lapsed, we can't make up that lost time, as it were. Whatever monies and things we're going to have, it's almost like a giant bubble that's going to work its way through the system for years to come, type of thing. Would you not agree?
I think there will be long-term negative effects, if only for the simple reason that some industries are going to be, even with bailouts and things like that, some industries I think are going to be permanently, at least for the foreseeable future, negatively affected. How many people are going to be going back in the movie theaters? How many people are going to go back onto cruise ships? Some will, obviously. Again, people can make logical cost-benefit choices about these things. The restaurant industry, will the restaurant industry have to move to a model where they have tables farther apart, which means, of course, less revenue per restaurant? All sorts of things are probably going to be adversely impacted. On the other hand, every business that involves home delivery might wind up with greater economic opportunity. But nonetheless, I think there will be a long-term economic cost. And I'm just talking about in the context of the disease. Now let's think about something that actually worries me a lot and I write about a lot, which is what's the danger that we're going to have a long-term increase in the burden of government? We talked earlier about, wouldn't it be great if we learned a lesson about how we need to get rid of all this regulation and red tape with the FDA and CDC? What if politicians, as they're, of course, want to do, what if instead they wind up giving the FDA and the CDC big budget increases, sort of reward them for failure? That happens all the time in Washington. We're seeing all these bailouts and government intervention through the Fed in terms of the allocation of capital in our economy. Are we really confident politicians are going to give up that power they now have over the economy? My guess is they'll give up a lot of it, but I bet they hold on to some of it, and that has the potential for hurting our economy in the long run. What about all the debt that we're running up? Now, I'm not one who normally fixates on debt too much. I think it's much more important to look at the size of government relative to the size of the private sector. So, for instance, government spending as a share of GDP, I think that's much more important than the annual deficit. Nonetheless, if you keep acting like Greece and Italy, sooner or later, you can have a debt-caused fiscal crisis in your country. I don't think we're anywhere near that point yet, for the simple reason we're the world's reserve currency, we're the world's safe haven for flight capital. So I think Uncle Sam can probably borrow another $10 trillion before we get to a point where investors begin to not trust whether we can pay it back. But nonetheless, there are all sorts of straws being added to the camel's back of our economy. Now, our economy is very strong. unlike Italy or Greece, we have a relatively healthy camel, if I can abuse this metaphor, but it's still not good to add more straws to the back.
And you know what, it sort of seems like we're going to be in that little lull when it sort of dies down. The public's still reeling on its heels, but the government's just like you said, they're figuring, what do we do that we did wrong? And they're going to just load on more regulation or whatever, because we're not paying attention at that point to defend against that. So it is a risk for sure. Charles, I see your hand up as well.
Thanks, Jeff. Dan, have you looked at some of the countries or even U.S. states that did not lock down? For example, Sweden gets a lot of press every day. They lock down high schools and colleges and large gatherings, but otherwise, there's lots of video with streets filled with customers, restaurants. It's pretty much status quo there. There is some sheltering in place, especially with the old and sick. Others are trying more telecommuting, which is, I think a good thing, and that could innovate businesses in a good way long term. But as Germany and Austria and Denmark prepare to open their economies, having seen Sweden give a good example of allowing that natural herd immunity to take place, it seems Sweden has not suffered economically as bad as the rest of the developed countries. Have you looked at that comparison between countries and states in the U.S., the Midwest states, mainly Iowa, that kind of thing? Laura Ebke is on the line. She's a former senator from Nebraska. What about that comparison? Have you looked at that at all as an economist?
I've looked a little bit at those types of issues. We obviously won't know for a while what the impact is on a country by country basis in terms of their economic output, their economic growth rates, or in this case, we're going to be looking at economic contraction rates. My gut instinct is to like what Sweden's doing. Now, on the other hand, it appears that compared to other Nordic countries, they do have higher death rates and infection rates. Now, it could very well be that they're biting the bullet and getting a lot of it over with now. And in the long run, other countries that are trying to sort of let the air out of the balloon slowly type strategy, it might be that then their death rates eventually catch up. And also, let's consider the fact that even though there isn't an official government mandated, or at least there's a relatively limited government mandated lockdown in Sweden, there's an awful lot of voluntary social distancing. And I have to imagine that even if, I have no idea whether the government shut off movie theaters or something like that, but I would be stunned. I would be utterly shocked if movie theaters weren't basically closed simply because consumers didn't want to go someplace, places where there might be crowds. So there's, even though there might be different systems in place in different countries and different states, I think behavior of individuals is probably relatively similar across the board. If you say you compared Sweden with Denmark, I wouldn't be surprised if individual households, individual families, individual businesses are displaying the same type of cautious behavior. In other words, you probably don't need government to sort of stick a ring through our nose and lead us around. We know there's a dangerous disease out there, so we're all just going to instinctively be much more careful about how we deal with these things.
Absolutely. Let's see if we've got some questions from some of the other visitors for today.
Jeff, I think Ralph is on the line, and he's a FDA lawyer. He may want to comment on some of the questions asked earlier about, especially on the mind of a lot of libertarians, whether lockdown should be extended until either A, testing shows antibodies, or B, they've taken a vaccine, whether there's full transparency on the safety and testing or not. I don't know, Ralph, do you want to comment on that?
Well, there are a lot of things.
You weren't there, I guess, earlier for that question.
Can you hear me?
Yes.
Yeah, I was listening in. Very intelligent discussion. I think, however, that one has to follow the money, to use the title of an article I wrote that appeared in today's opensourcetruth.com. And following the money is very interesting. For example, According to State Senator and Dr. Scott, last name, I'm sorry, it's in the article, the report by John Rappaport, if you get pneumonia and end up in a hospital, Medicare pays $4,900. If you are diagnosed as having COVID, it's $13,000. And if you're put on a ventilator, even for a few hours, it's $39,000. So if you follow the money, you find that there's a huge incentive to finding as many possible cases of COVID as you can and treating those people for as little time as possible. So maybe there's some perverse incentives going on right now. I do, however, completely agree that this is a perfect time to propose rolling back regulations. You know, whenever there's a crisis, government grabs new powers and creates new programs, temporary programs and powers that seem to last forever. We should use the same tactic, and we should be pursuing Trump to follow his better instinct, which he's done to some degree, namely rolling back regulations, as many as possible, because maybe some of those will be rolled back for a long period of time, and that would really help reestablish the economy. You know, from a standpoint as a libertarian and as a scholar of the law, I want to note that the federal Constitution has no provision for lockdowns due to contagion. Indeed, when the founders drafted the Constitution and they put in the clause about the suspension of the writ of habeas corpus, it is only for invasion and rebellion, nothing to do with contagion, although the founders were very much aware of contagion, and there were pandemic diseases every summer in Philadelphia and New York, for example. I think that we have to question certainly whether the federal authorities could lock down the country. Now, as it turns out, it's the state governors claiming to exercise the police power, which has resulted in the government turning off our economy. I do not find any lawful authority for that sort of remedy. I believe it's a matter of panic on the part of politicians who do not want to be seen as having done nothing. And now we have a situation where the same politicians are not going to want to be the first one to reopen society. I do note, however, that the government is functioning fine, and maybe we're all learning a lot more about using the internet for our daily activities. Interesting possibilities. I'm very concerned about the road to the vaccination question. Whether or not the pandemic is real, which means whether or not at the end of this year we're going to see that there was an uptick in actual deaths in this society, or whether we're just trading different types of deaths at different times. We'll see when it works out. I do know that this is being used as a major marketing ploy for vaccination. Vaccines being, according to our courts, unavoidably unsafe and therefore absolutely subject to the rule of informed consent, versus the situation that we find ourselves in, where we're told if people are allowed to exercise their civil rights, the whole of society will collapse. So we turn off the whole of society, basically, and begin to question the right of informed consent, which is being very widely questioned, especially by, for example, Bill Gates and his cohort. The plan, if I can call it that, is to subject us all to either mandated vaccines, proof that you have immunity to a disease for which people may not be able to develop immunity, or you're going to stay home. And, you know, I'm 75. I'm happy to stay home. In fact, I've been self-shielding because I know that there's a virus out there and I want to avoid it as much as I can. But I believe that this has been the greatest marketing ploy for vaccination in American history, that we are going to get, there are 70 companies rushing to be the first one to get the vaccine over the approval line. And the approval line, now we have a real rollback in regulation. We're going to just sort of approve anything. Curiously enough, the company that says it can have a vaccine out in 1 month has been working on a SARS and a MERS vaccines for the past 5 years. Of course, they are also coronaviruses. And I think we have a very serious, risky situation right now. The government told us all to go home so we would not develop natural immunity. 80, 90% of all the COVID cases are very mild. And if having the disease confers immunity, and that's not yet known, then the herd needs to be exposed. We can't spend the next 100 years waiting for the next pandemic. And I think that we are watching a political charade. We are watching the governors of New York and California trigger an American economic shutdown. We watched the stock market bubble being popped, which, by the way, may work for Donald Trump. Imagine if the stock market had popped in October, just before the election. People might have actually voted for Joe Biden, as crazy as that might be. My view, the Supreme Court said it in the case of McNeely versus Missouri versus McNeely, 2013. McNeely has a one-car accident. He's rushed to the emergency room. As he's being rolled into the emergency room on a gurney, the police officer on one side of him is saying to the nurse on the other side, "Take his blood. I want to find out how much alcohol he has. Get his blood right away." McNeely is saying, and I imagine in a slurred voice, "Don't take my blood. I don't consent. Don't take my blood." They take his blood. He's arrested for drunk driving. He's convicted, and his case got up to the U.S. Supreme Court. In the U.S. Supreme Court, the Supreme Court looked at the case and said he didn't consent. The police officer could have gotten a warrant, an order from a court on the telephone in 2 minutes, taking the blood. But he didn't consent, and you didn't have an order. Therefore, case reversed. And the Supreme Court went on and said something very important. They said, "We have never wavered from our commitment to the proposition that you have a protected privacy interest in preventing an agent of the state from piercing the skin." Now, interestingly enough, in that 2019 case, the same circumstances, but the person was unconscious. And in that case, they were allowed to take the blood. So I think we have a very interesting situation growing here, a great clash between what is viewed by some as the collective good versus individual rights. And we will see what happens. I'm certainly going to be advocating for rights.
Interesting times indeed.
Yeah.
David, I see you've got your hand up there real quick.
Dan, we know that when we start opening up the economy, there will be a few people who deliberately put others at risk. And we normally depend on the government to protect us from those folks. They don't do a very good or consistent job. What is to prevent us from using our power of exit through economic and social ostracism to deal with these folks who put us at risk? Your thoughts on that?
I hope there's effective ostracism for people who deliberately put others at risk. But how do we even know who to target? Someone has coronavirus, and let's say they know they have it, and they know that they're in an infectious stage of it, and they go out to a mall, or they lick their hands and put then touch railings and stuff like that. Obviously, there's, at least I assume, there's a legal remedy, assuming you actually can find evidence that he did that and you got infected and you suffered damages, or for that matter, maybe even died. There must be some way to go after someone, at least I hope there is, through the tort system. But that's going to be a very, I think, slow and clunky way of dealing with it. And I think the pressure on the political system will be towards something much more aggressive. What that even is, I don't know. But I think one manifestation of it is that politicians are going to be very timid about reopening their states on the state level, because you reopen and then you're going to have someone in the news 2 weeks later who died because you reopened. And politicians always think about headlines like that. Now, they should also be thinking about, oh, this business is closing, this business has gone bankrupt, this breadwinner committed suicide because he lost income. There's all sorts of real harm, real damage, real health consequences, as we've already talked about earlier in the program, to these things. So I'd like to think that, well, first of all, I like to think that these governors won't really be in control of these issues, that they'll let people make intelligent decisions on their own. But again, barring a vaccine, barring widespread testing, which doesn't seem to be anything that's going to happen immediately, I think we're in for a rough spell. I am not overly confident or happy about where I think the economy is going to be going.
All right, very good. Well, that was a really excellent discussion there. We wanted to close out with one last comment. Fred was quizzing in about, do the states have police power?
If you're asking me, I'm not a lawyer. I have no idea what the common law treatment of these issues are. I have no idea what the legal status is. My understanding is that there's really no authority for Trump or any president to be ordering national lockdowns. So yes, I do much prefer the idea, if there is going to be government involvement, I would much rather have it on the state level or even on the local level, because obviously there's a much greater damage or much higher level of risk in a densely populated place like New York City than there is up in the Adirondack Mountains in upstate New York. And that's why we have some states that are very lightly populated haven't ordered lockdowns, because first of all, people are intelligently following social distancing as a matter of just prudence. And secondly, the population is so spread out that it's not really a relevant issue. Why order a lockdown in a place where people aren't bumping into each other as a matter of course anyhow? So we should be as decentralized as possible in our decision making on this. We should be relying to the maximum extent possible on the intelligent, informed decisions of the American people. And I can't help but just reiterate what I've said before. We need to be very cognizant of the danger that government is going to grab permanent new powers to intervene, control, regulate, tax, and spend as a result of this pandemic. The great economic historian Robert Higgs, he wrote the book Crisis and Leviathan, on how government does tend to get bigger every time there's some sort of crisis. And I hope this isn't going to be a new chapter in his book.
Be interesting to see where we do end up for sure. Well, Dan, that was a great conversation today. I wish we had more time, but I definitely want to thank you for being here today.
Well, great. I enjoyed the conversation.